Okay, welcome back, Pahrump. I'm here tonight with Dr. Creig Christensen, my partner in the new Independent Wellness Center, which is 2080 East Calvada.
Yes.
Right on the I, right across from the county center, right next to the Veterans Administration. We'll have a banner up there.
It's up.
It's up? Okay. So if you're coming down that Calvada I going around there, it says chiropractor on the building, but now we're gonna be doing that, and I'm really excited about this opportunity. I'm really excited about combining our services, being able to offer that, and being able to work with patients. And what we were talking about in the break was the patient that Ray talked about, and radiation, and you know, radiation burns that tissue really deep, and when you burn something internally, it's going to create this tremendous amount of scar tissue. And the scar tissue by itself is not flexible.
No.
It doesn't get very much blood flow, if it gets any at all. It's very subject to tearing, which is very painful. So we talked about that on the break, and we both agreed that it's just increasing stretching and mobility, and slowly, because that's the only way you're going to get any improvement out of that person.
Absolutely.
And if nobody's working with them, which is what you need to do to help that. So, you know, and that post-surgical training, that post-surgical, you know, scar tissue is one of those very, it's an interesting thing that happens. It's never strong as regular tissue.
No.
And it's never as flexible as regular tissue.
No.
And it is always subject to tearing, stretching, and pain. So you can almost wonder why anybody has surgery at all, because the process of healing is almost maybe sometimes worse than the disease itself.
Sometimes, that's true, Mike.
Yeah, so you have to be very careful, and surgery is often a last resort. But hopefully maybe Ray can get Paul to come in there and you can work with him, because I know you do some wonderful things for people. I was talking a little bit about that radiation, and we were talking to that, and so I think that town is Lathrop Wells. I think that's as you go towards Beatty. But there's an increased background radiation there, and then if you go to that eco lab where I guess I had that fire, I had my Geiger counter out there, and it didn't peak more than 0.13, and actually crystal was very low in background radiation, 0.8. Now, what's kind of interesting, if you ride in an airplane, okay, and you turn that thing on, you're getting 0.2. When you're here, it's 2.2. It's almost 100 times more radiation being in an airplane than being on the ground. And it's ionic radiation, meaning atmosphere. We don't realize how much we're protected by our atmosphere. So I kind of did a little study, and I kind of figured out how much is that. So, you know, if you fly, and I'm like, why do pilots, there is a slight increased risk of cancer in pilots and things of that nature, but not really off the charts. I mean, not really off the charts. So when it seems like it's a very ominous amount, but you would have to fly 96 years straight in order to increase your risk for some type of bad outcome at that level of radiation. So, but I did, there's one patient that brought to me an actual bottle of thorium, I guess, and I guess he's using it in some fertilizer stuff. I mean, it's like, so you put that Geiger counter right there, it's actually less than being in an airplane. It's like 1.7 is the microsieverts. And radiation is one of those things that goes by time, distance, and barriers, right? So there's actually a nice chart that talks about how much lead you would need to stop so many rads and things of that nature. I might bring it up and put it on the chart. But if you take that thing and just move it 1 foot, the radiation goes to 0 from that product. So, and I think it's good if you build here in Pahrump or you build anywhere, it's a good idea to look at something like that. They're really cheap. I mean, it's like $100. Someone borrow it from you, or, you know, get a Geiger counter. Radon is a big deal, you know, especially, we don't have a lot of basements here because of the poof dirt, but a lot of people who have basements tend to have a lot of radiation, a lot of stuff of that nature. So, anyway, we have Chuck on the phone. Chuck.
Hey, Doc.
Hey, Chuck. How you doing?
Good. How you doing?
Great.
Thursday, my 80-year-old homeboy decided to move stuff from one storage to the other and slipped on a ramp and broke his hip.
Oh, Lord.
So he just got out of surgery, I guess, today, or recovery, and he called me, and, you know, he's going to be doing some stuff down there as far as rehab, but I was wondering if you guys will be doing things like that.
That type of rehab on a patient that old is usually done at home until they are up and mobile. But once they are up and mobile, yeah, we're more than happy to take a look at him and get him moving.
Yeah.
More than happy.
Okay, great. And you'll take VA, or not VA, Medicare, right?
Oh, yeah.
Absolutely. Yes.
Absolutely.
Okay, great. Thanks a
Yeah,
lot.
we basically take all the insurances. That was part of the issue. The only thing I think we don't take is obviously is healthcare partners, and Senior Dimensions is contracted with someone else, but I am a Senior Dimensions provider, but we have to work out a plan with them. But everything else, we're good to go on. And I think that even so, Craig, you're very good at giving people really incredible discounts for a small amount of money to take care of them too.
Yeah, it's been our philosophy. You know what? We don't want to make it hard on anybody. So we do. We work with people. We work with what they can afford and what they can't afford to make sure that they get the top service that they can get and that they get better.
Yeah, and I think you can do that because you run. I love the way your approach to what you do is almost like your experience in sports medicine, because you have this open environment for treatment rooms, even though the space is a little bit different than the previous space you had. But I mean, that environment allows you to basically be able to treat a lot of people at the same time.
Yes.
So it isn't like me. I have one patient in one room at one time, and I only can do so much. But you can be working on somebody else, and you have your helpers doing those and doing
Yes.
that stuff. And usually when you put somebody in traction or you do something like that, they basically have to sit there. So I mean, you're not sitting there on your watch watching them.
No.
You're off to the next guy that needs doing something like that. So that makes it incredible to be able to treat so many people. So that's how I think you can afford to give somebody a discount, because you're not limiting what you're doing. You're increasing your overall structure. Boy, we got Ray again. Thank you for calling, Ray.
Yeah, Doctor, it's a refractionated laser as far as the scar tissue. We talked about it a few weeks ago. It's big in Florida. They're doing wonderful things with it. Who knows what it's capable of, but right now they're just doing it for serious scar tissues. And the question I'm posing now is, I saw a tape that Chuck Augustine gave me about Dr. Stanisław Brzezinski in Texas. And for 30 years, he's been harassed by the FDA because he's treating people for cancer. A lot of these cancers are being cured, inoperable brain cancer, all kinds of cancers. What is wrong with the FDA that they're going after this guy and they won't leave him alone? And if you can comment on what he's doing, because I think it's a very positive thing. And I'll listen off of the phone here, and I'll call you a little later. Thank you very much.
Yeah, I don't know. I don't know exactly what treatment he's offering. I'd have to research that. But the problem with it is with the FDA, and it's both a good bad thing, which is there are people out there that really scam people. Okay, I mean, this is the one thing that I find, and so. The Food and Drug Administration was established to prevent carpetbaggers and people that were running around handling the potion of the lotion that cured anything and everything. And when you've got cancer, I mean, you become extremely desperate for a cure. And so stem cell, and there were people that obviously were given injections, they had no stem cells in them. There are a lot of vultures out there that have no compassion, have no sense of honesty and forthrightness, and basically, they don't, I guess maybe they don't put their head down and sleep, because I couldn't do that to people and feel good about myself. But that being said, I do believe that when the guy has something that he's trying to do something that is good for people and it is working, it's hard to get that data published. Like I was saying the other night, the drug metformin has been out for years. They've done studies to show that you can actually, it used to be that metformin was feared in patients in renal failure, and there are different levels of renal failure, but for the purposes of the discussion, creatinine clearance at a level of 60 or less becomes what they call stage 3. And usually at 45, creatinine clearance of 45 is where they drew the line on using metformin. Well, they've actually seen that it's safer to even go down into the lower 30s. But nobody will change the package insert because it's generic. It costs $1 million to to change a packet insert, the FDA, to petition the FDA costs you $1 million. Well, nobody's doing it. Okay, so therefore, it hasn't been, this treatment that's out there that can be so-called quote-unquote used is not going to be justified for the public because nobody's going to pay the $1 million. And Congress is aware of it, but they won't do anything. Now, I know that didn't answer your question about Dr. Brzezinski. I mean, the point being is that until you actually do some studies that actually show that this treatment works in this cancer and works for that and things of that nature, that doesn't hit the mainstream, but nobody's got that kind of money. Nobody's got that kind of money to go in front of the FDA. So they have the power to persecute this poor guy, okay? And I don't like it any more than anybody else does, but they have the power because he is not doing an FDA-approved treatment. Okay, so unfortunately, Ray, this guy probably should take his bags and go somewhere else across the border where he can do what he can do and out of the reaches of the FDA. And I think that that's the only way that he would be able to, you know, exist doing that without being pressured and things of that nature. It's just like the guy as a Dr. Kaplan. He was a urologist. Okay. What happened is this Dr. Kaplan was reusing a prostate biopsy needle. Now, he was sterilizing. It wasn't like the colonoscopy scare several years ago where they were using the same bottle. He was actually going through the deal to take a needle and was sterilizing it and doing everything he could and reusing the needle. He got in trouble because it was the FDA approved for one-time use.
Yeah.
And he got his clock clean because of that. I don't know what the outcome was, but it's a good guy that's basically trying to take it. Well, it's just like when you get these old sterile instruments in a suture kit, you know, they sterilize them and reuse them, you know. But apparently, if the FDA approves it as a one-time use, then that's what it's supposed to be. And if you do that, they can come down on you. It's like nobody, you know, and ignorance to law is not an excuse. So, Arlene, we have you on the phone, and we're going to go to break in just about a minute. And if you can hang on, we will pick up your call when we come right back. Thanks for tuning in.